Hey physios, so as you already know, recently I have created notes of orthopedic PT management. So right now I am uploading a demo video in which I am covering ankle sprain PT management, and in case you want to buy my notes of orthopedic PT management in which I have covered literally every topic. For that I will mention everything in the description box and comment section both, that will guide you how you can purchase that. So now let's start this. So basically there are three stages. First is acute stage, second is subacute stage, and third is chronic stage, which is also known as maturation stage. So what will be the goal of a physiotherapist in acute stage? So first of all, we have to protect that injured tissue from further injury, because of course if he will continue his all activities, then of course there will be additional stress on that joint, there will be further injuries. So we will prescribe that patient proper rest so that he can recover from that injury. And in case of grade 1 ankle sprain, in which there is very mild injury to ligaments, then he can perform mild to moderate activities. But in case of grade 2 and 3 ankle sprain, in which there is 50% or complete tear of ligaments, then there will be greater limits on their activities. And other ways to protect that injured part is by using splints or brace, or by just taping around that ankle area. So all these things protect that injured tissue from additional stresses, especially in second and third grade ankle sprains, because in that there is 50% or complete tear of ligaments. एंड इन केस पेशेंट वांट टू मूव, बिकॉज वो एक जगह बेड के ऊपर हमेशा रेस्ट तो करता नहीं रहेगा, उसे चलना भी होगा. तो इन केस ऑफ ग्रेड सेकेंड एंड थर्ड स्प्रेन एंड पेशेंट वांट टू मूव, ही कैन यूज असिस्टिव डिवाइसेस such as crutches and cane, and with the help of these devices he can move easily without putting much stress on his injured tissues. Now one most important thing to remember during this stage is, if we prescribe prolonged period of immobilization, then it can lead to muscle atrophy of the surrounding muscles which are immobilized, or there is weakening, contracture formation, joint stiffness if we prescribe prolonged period of immobilization. So we have to shift the patient to mobilization phase as soon as possible when his inflammation or pain subsides, and we also have to keep mobilizing his surrounding non-injured area so that they don't suffer from weakening and atrophy. Now the next goal of physiotherapist is to encourage tissue healing. So there are two ways. First, we have to provide proper rest and protection, because it will prevent additional stresses on that injured area, and in this way a patient can progress to normal healing. And the next way is ultrasound. So I have written all the doses that we can use in acute stage to heal or to progress that tissue for healing in acute stage, and it is taken from a research. Now the next goal is to limit pain, swelling and spasm, because in acute stage there will be of course inflammation, so we have to limit that inflammation. So the standard protocol is RICE protocol. This RICE protocol is applicable for every sports injury. So we have to apply ice because it can prevent swelling and decrease pain. I have written all the doses that is appropriate for that particular modality. So along with ice, compression with elevation is also effective in reducing swelling. Now here is one more thing. If we perform movement of non-injured tissues such as toe flexion and extension, because those muscles are not injured, the main injured ligaments are of ankle joint, medial and lateral ligaments are injured, so we can perform movement of other non-injured tissues. And if we perform high repetitive low intensity movements, then it actually helps in reducing swelling even more effectively. So apart from RICE protocol, we can also do mobilization. So there are basically 4 to 5 grades of mobilization, and in which grade 1 is basically given to minimize the pain. Now here is one important thing. Some of you might have thought, why the hell are we minimizing the inflammation? Because after all, it is important for healing. This is what we studied. But here we are not completely stopping the inflammatory process, because of course it is important for healing. So we are just minimizing the inflammatory process because it is excessive and we don't want patients suffering from pain and swelling. So we are just minimizing it. We are not completely stopping it. Now the next physiotherapist goal is to maintain function of non-injured tissues. As I already told you that we will provide rest to the injured ligaments, muscles or tendons, but we don't want that non-injured tissue to become atrophied or weakened because of rest or immobilization. So we will maintain the normal function, normal range of motion, normal strength of non-injured tissues. So the exercises that we can prescribe to patient to maintain the range of motion or strength of non-injured tissue is, so first is plantar flexion and dorsiflexion range of motion. So we can initially do passive range of motion exercises, then we can progress to active assisted and then to active range of motion up to the pain limits. Like we don't have to cross the pain limits, so we have to remain within the pain tolerance. We can also perform movement of MTP joints, and we can also perform some stretches of Achilles tendon and calf. And apart from that, we can do towel curl and marble pickup exercises. So in this way, we can perform these exercises to maintain the strength of intrinsic muscles. And apart from this, we can also do cryokinetics, which you have already studied in your electrotherapy subject, in which we place that injured ankle in a cold bath for 15 to 20 minutes, and it helps in making that part numb so that patient can perform any exercises or weight bearing after that period. Because that area is numb, so patient can easily perform exercises without much pain. Now next goal is to maintain overall body conditioning. So for this, we can prescribe patient stationary bike or upper body ergometer. So all these activities will help patient to maintain his cardiovascular endurance, because we don't want it to decondition during the period of rest. Now next stage is subacute stage. So you can see all the goals of PT. In this stage, we will gradually build the strength, range of motion of the patient. Now first is prevent further injury. So again, we will not let patient to return to the restricted activities completely, because still scar tissue is weak. So we will not let patient to return to his restricted activities completely. And in case of grade 1 tear in subacute stage, patient can avoid using cane and crutches, and full weight bearing can be done. But in case of grade 2 or grade 3 sprain, which is quite severe, so in that case the protective devices should be continued. Now the next goal is to minimize pain and inflammation. So these thermotherapy, ultrasound, cryotherapy, mobilization, these things you have to mention each of the every topic of orthopedic, and I also have mentioned in my notes. And if you want to buy it, I will give all the details in the description, and those are amazing, and I have also mentioned all the doses in that as well. Next goal is to maintain range of motion and flexibility. So for this, we can use paddling on stationary bike. Patient can sit on a stationary bike and he can perform paddling. In this way, it will help to increase range of motion of dorsiflexors and plantar flexors. But you have to remember that during the initial stage, limited plantar flexion should be done, because it can stress ligaments. So we have to limit the plantar flexion. We can also add eversion, but in case of lateral ligament injury, inversion should be avoided because it can again stress the lateral ligaments. Now, initially always perform active range of motion instead of active assisted or passive range of motion, because if we perform passive range of motion, therapist can stretch those ligaments excessively, and we don't want that. So initially active range of motion is preferred over passive. And we can also progress to grade 2 and grade 3 joint mobilization if we want to increase the range of motion of that joint. Now, next goal is to restore muscular strength and endurance. Now, to increase strength, we will first go with isometrics, because if patient has less than 3 grade, then we should always perform isometrics to increase the strength of those muscles. So we, in neutral position, in neutral ankle position, we will perform isometrics of plantar flexors, dorsiflexors, inversion and eversion. In case you don't know how to perform isometrics of ankle, I already have one video and you can watch that to understand it better. And then you can progress to isotonic exercises, and then you can gradually add resistance, but again you have to do this gradually. We can't progress very fast to resistive exercises because it can lead to injury. Now next goal is to reestablish proprioception, agility and coordination. So now progress to full weight bearing exercises, perform weight shifting exercises, forward, backward, side to side weight shifting exercises, and stepping up and stepping down exercises. And you can also induce perturbations in order to increase the proprioception of the patient. And you can also perform walking, backward, forward, lunges. Now the last stage is maturation stage or chronic stage. So in this stage we have goals like to increase range of motion, flexibility, muscle strength, endurance, proprioception, and to maintain the overall body conditioning. So the first goal is to restore motion and flexibility. Now in this stage we want patient to have full range of motion, so we will start with aggressive stretching, because now the scar is quite mature, so we can perform full stretching exercises for long duration. And we can also progress to grade 3 and grade 4 of mobilization. In case you don't know where to give grade 1, 2, 3 mobilization, then I have already made video on the same. You can go and check it out. And then you can also give massage, because there is chances that in that area patient can have adhesions. So to break that adhesions, we can give myofascial release techniques or cross fiber massage. Now to further increase the muscular strength, if that patient is of sports member, then we can give polymetric exercises in which he has to perform vertical jumps and quick change in direction, as you can see in these images. And last goal is to improve proprioception and agility. So in this, the patient can perform squatting on unstable surface, like you can see in that image. He is performing lunges, so he can perform all these exercises on unstable surfaces. And he can also perform single leg standing on unstable surface. So yeah, this is it, and I have all notes just like this. Those are amazing, and you can buy them if you want. And in those notes I have also added diagrams that you can add in your answers in order to gain good marks, because in this PPT I didn't add those diagrams. There are just pictures which I took from my book, but in that notes I have also added diagrams, handwritten diagrams, that you can add in your answers.